The newborn screening test is one of the public health preventive program which is worldwide used for the prevention of disabilities or death of the babies, and these are congenital metabolic disorders which are done by a simple test of the blood spot on all the babies born. Similarly, prenatal screening is also during pregnancy. We do this test for the well-being of the fetus, and we can give them a reproductive options to find out whether the baby has a birth defect or not. So these are the tests which are introduced mainly called as a genetic screening test. However, the next line diagnostics has a unique, or I would say as a pioneer in having the comprehensive services in the country, having the screening, diagnosis, therapy management, and also counseling to the families and the parents to prevent the disabilities in children.
The importance of prenatal screening cannot be overemphasized. Every year, about 4 million babies are born with birth defects, and this acts severely to the morbidity of the newborn. The antenatal screening consists of evaluating the mother's blood in the first 4 months of pregnancy.
Tell us something about your son Vedant.
Vedant was born underweight, and when he was born, the family was very supportive, and they said, no, don't worry about the child because he is weak and because he is underweight. You know, he is having these milestones slow because he couldn't sit, he couldn't walk, and he couldn't take at the normal age. So once, only after 1.5 years, I came to know that he had Down syndrome.
Knowing that Vedant is a Down syndrome child, how has that impacted your life?
Yes, when he was, the pediatrician said that he had Down syndrome, I was absolutely shocked, and I had a lot of feeling of guilt, anger and frustration in myself, saying, why me? Why my child? Why should it be abnormal like that? That means he's not going to be normal, he's not going to do anything. That's what I got the impression from the pediatrician. And through the 40 years we consulted, when he passed off in 40 years, I think the impact I had in my life, in the beginning it was a very, very traumatic one. But once I accepted him and I got to know him, that selfless love and that, that richness that I've got in my life, I think that's amazing, that whatever I had.
If prenatal screening was available back then, how would have it helped you or aided you in taking an informed decision?
Yes, it would have definitely helped me in making a better decision and knowing about Down syndrome, because it is important to know whether my child is normal or not. And also, you know, the acceptance that I got only after about 4-5 years, I would have accepted my child. If I wanted to go on ahead with my pregnancy, I would have known, yes, this is what it is. I want to know what is Down syndrome and what would be the result of having a child like this. Because it is let me tell you, it is a very, very, very traumatic experience if you just come to know suddenly.
How did you come to know about prenatal screening test?
My gynecologist told me to take the test and I went ahead with it.
What was the outcome of your test?
The outcome of the test was positive for Down syndrome.
How did the test result help you to make an informed decision?
I was above 35 years of age, and the testing started in the year 2000. I was advised by my doctor to go in for the testing. So I took the triple marker test, which was 3.5, which was supposed to be the danger zone. So my doctor recommended I go in for amniocentesis, which I did. The results of the amniocentesis was that the baby would have 24 pairs of chromosomes and that it would be a 99% Down syndrome child. The doctor also recommended that I do not go ahead with this pregnancy. My husband and I also decided that we should end this pregnancy.
Would you recommend prenatal screening tests to other expecting women?
Yes, definitely I would recommend this test to all pregnant mothers. Personally, I feel that because of this test, my life has changed forever. If I had gone ahead with this child and there was no test, my life would have been totally different. I would definitely recommend it.
Nisha, I see you're pregnant. Have you done your prenatal screening test?
Yes, I have done my prenatal screening. Though I don't fall into the high risk category, I'm just 28 years old, but thought I should go ahead and do it to ensure to know my baby's health is all fine.
Would you recommend prenatal screening to other pregnant women?
Yes, of course I would. Like in my case, my results are negative, and that has given me a sense of comfort that my baby is all fine.
Initially, it was thought that maybe screening of high-risk patients would be adequate, but a large number of babies are born to mothers who have no high-risk factor, no age-related or family history problems, especially as far as trisomies are concerned. So I would strongly recommend the use of prenatal screening in all pregnancies by obstetricians all over the world.